Good morning, and thank you all for joining us here today for an important update about fentanyl in our communities, as well as the distinctive and united way in which Riverside County is addressing it. Fentanyl deaths have risen to alarming rates, tragically affecting families from every race, ethnicity, and socioeconomic group. As you can see from our speakers and other county leaders here today, the County of Riverside is fighting fentanyl on all fronts, ranging from our law enforcement departments to our health departments. Our speakers today are Riverside County 2nd District Supervisor Karen Spiegel, Public Health Officer Dr. Jeffrey Leung, Sheriff Chad Bianco, District Attorney Mike Hestrin, Christina Rodriguez, mother of Ernie Gutierrez, who tragically died last year from fentanyl. Riverside County 3rd District Supervisor Chuck Washington. Important to note that both Dr. Leung as well as DA Mike Hestrin will make their comments in both English and Spanish from the podium, as we have several Spanish media partners here with us today. We'll take questions on fentanyl as well as our public awareness campaign at the end of the news conference. Supervisor Spiegel.
Well, thank you, and I'm so glad to see that you find this to be important and that you're here today. Riverside County is leading the way in the entire state responding to the opioid epidemic. Supervisor Chuck Washington has joined me in establishing a multidisciplinary committee to assess the current state of fentanyl-involved deaths and overdose within Riverside County. Our goal is to bring all the different disciplines together to share information, the data and resources with the mission to prevent poisoning, and we use that word, poisoning, not overdose, deaths from the illicit fentanyl. The impact of this drug is felt in very different parts of the society. There's not one definition of who. And so our response must be varied across the multiple departments, focus on different aspects of the response. The committee is varied, and it comprises representatives from Riverside County departments, including Riverside Universal Health Systems, Behavioral Health, Department of Social Services, the Office of the District Attorney, Emergency Management Division, the Executive Office, Riverside Universal Health Systems Public Health, Riverside Universal Health Systems Medical Center, Probation, and Sheriff's Department. All these leaders of these departments are here with us today. The committee began meeting late last year, and since that time, we've accomplished much. The behavioral health team provides substance use treatment options, as well as partners with law enforcement teams and mental health and overdose calls. The public safety team is doing seizures and prosecutions, a critical aspect because they know we are serious in Riverside County. The emergency medical services team rolled out Narcan to all first responders, including EMS, fire, and law enforcement, as well as leaving behind Narcan and kits for bystanders. The data team from Public Health and the Emergency Management Department has given us real-world, actionable data as it relates to the opioid overdoses and focusing on fentanyl-related overdoses, poisonings. For example, we can tell that from when the Narcan is administered by the first responders saving lives. And the Narcan leave behind kits are also saving lives. We must continue to save lives. So throughout this past year, this team has been working together and continues to assess the current fentanyl awareness and education programming, as well as overdose response and treatment efforts, all being undertaken in their departments. That's why there's multidisciplinary. Each one has a very important role. In addition, the Fentanyl Committee is working together to address needs. Before I unveil the Faces of Fentanyl campaign, it's important to note how the data collected from the departments have helped us with this campaign. Fentanyl poisonings, overdoses, deaths are happening across all racial and ethnic demographics. There's no one that is not possibly being involved in this. knowing and unknowingly. The most common age of those affected, sadly, are teens, 20s, 30s, and 40s. This is why our campaign, Faces of Fentanyl, focuses on multiracial ethnicities and age groups. Fentanyl is showing up in all forms of drugs, making the image of what fentanyl looks like extremely varied. You can't say, this is fentanyl. It's intentional. With that, I'm happy now to unveil the PSA for the Faces of Fentanyl campaign. Please join me.
There is a drug killing thousands of people in our communities. It can be hidden in all drugs. Meth, heroin, pills. The tiniest amount of it could kill you. It's a substance called fentanyl. There is a drug killing thousands of people in our communities. It can be hidden in all drugs. Meth, heroin, pills. The tiniest amount of it could kill you. It's a substance called fentanyl. You may think it won't happen to you, but you are not the exception. Don't be another face of fentanyl. Learn more about the deadly dangers of fentanyl at facesoffentanyl.net.
Thank you and good morning. We wanted to speak today about an issue that is harming a growing number of individuals, families, and communities across our country, taking the lives of those young and old from every segment of the population, regardless of race, gender, or economic status. It is not a virus or an infection, but it is a drug that can claim a person's life, sometimes without their knowledge. The issue is fentanyl, and it is devastating families throughout the nation and here in Riverside County. Fentanyl is highly addictive and is a drug that is 50 to 100 times more powerful than morphine or heroin. It is used sparingly in the medical world for severe pain. However, when used outside of that setting, it can be unforgiving and fatal. Our mission at Riverside University Health System is to improve the health and well-being of the people in our communities. That is why RUHS is using every resource in our system to educate the public on the dangers of fentanyl, track the drugs movement in our communities, and treat those with substance abuse disorders. The RUHS Riverside Overdose Data to Action Team has partnered with departments and agencies across the county, including the Sheriff's Office, the District Attorney, and Emergency Management, to gather and share real-time data to help tell the devastating story of opioid and fentanyl use across Riverside County. Overall, overdose deaths in Riverside County have doubled in the 5 years between 2017 and 2021, mostly due to fentanyl. 50% of overdose deaths in 2021 involve fentanyl. Fentanyl-involved overdose deaths have increased from 28 deaths in 2017 to 406 deaths in 2021. The average age or median age of all overdose deaths is 46 years of age. Despite these tragic numbers, many are not aware of the dangers of fentanyl. This is why raising awareness is critical. If you have children, we encourage you to speak with them openly and honestly about fentanyl and drug use. And if you have a loved one that you suspect or are concerned about, we encourage you to seek help from one of the many resources in Riverside County. These difficult conversations can help save a person's life. Additionally, naloxone or Narcan is a potentially life-saving medication that can be used just after an overdose, and it should be made readily available in any place where we think there are people at risk. On the front lines of this battle are all of our behavioral health and substance abuse providers across our region, whose daily work includes the support and treatment of individuals struggling with addiction. RUHS Behavioral Health is a critical part of this effort. Their substance abuse prevention team conducts community outreach to prevent drugs from falling into the hands of our children. Substance use disorder is a complex condition that requires intervention. That is why behavioral health has established 13 clinics across the county for those with substance use disorders, 6 programs for those with opioid use disorders, and the new Arlington Recovery Center and Sobering Center, which helps those under the influence of drugs safely become sober and then transition into rehabilitation. These sites provide holistic care to patients by combining mental health treatment with medication-assisted treatment to help patients detoxify from drugs and begin their recovery. Behavioral health has also partnered with RUHS Medical Center to offer services at the hospital's emergency department to help people begin their recovery journey immediately after surviving an overdose. Today, you will hear a powerful story about behavioral health integration with the Sheriff's Department and how community behavioral assessment teams are working to keep people with substance use disorders out of jail and prisons and get them the help that they need. These are just a few of the many actions RUHS is taking to serve lives and keep our communities healthy and well. The RUHS team is grateful and humbled to be a part of the multidisciplinary effort in Riverside County that you see assembled here today, where we all have gathered for a single purpose of raising awareness about the dangers of fentanyl. By continuing to work together, sharing our stories, and having these important conversations among colleagues and loved ones, we can save many lives. Buenos días y gracias por acompañarnos. Hoy les quiero hablar sobre un problema que impacta a varias porciones de nuestra comunidad, arrebatándole la vida a jóvenes y mayores de todos los segmentos de la población, sin importar raza, género o estatus económico. No existe vacuna ni tratamiento para esto y puede afectar a una persona rápidamente sin aviso. Esto no es un virus ni una enfermedad que contagia de una persona a otra. Es una droga que le quita la vida a las personas sin darse cuenta. El problema se llama fentanilo y está devastando a familias por todo el país y aquí en el condado de Riverside. En total, las muertes por sobredosis en el condado de Riverside aumentaron el doble entre el 2017 y 2021, la mayoría a causa del fentanilo. De hecho, el 50% de las muertes por sobredosis en el 2021 fueron por fentanilo. Solo para darse una idea, en el 2017 ocurrieron 28 muertes por sobredosis de fentanilo y en el 2021 ocurrieron 406 muertes. La edad promedio de las muertes por sobredosis es 46 años. El fentanilo ha matado a cientos de personas y aún así muchos en la comunidad no saben sobre esta droga hasta que impacta a sus familiares. Al igual que otros retos que han afectado a nuestras comunidades, el Departamento de Salud Pública cree que la llave para reducir los riesgos y muertes por esta peligrosa droga es la educación. Es por eso que esta campaña de concientización es muy importante y que brinda la información necesaria para salvar vidas. Aunque nosotros estamos en contra del uso de drogas ilegales o del abuso de medicamentos recetados, le pedimos a los consumidores que usen productos de fuentes acreditadas y que eviten los productos distribuidos por Internet. También le pedimos a los padres de familia hablar abiertamente con sus hijos sobre el uso de drogas y el fentanilo. Esas conversaciones que suelen ser incómodas pueden salvar la vida de un menor. Aparte, Narcan o Naloxone ha sido eficaz al ser administrado en pacientes con sobredosis antes de llegar los primeros auxilios y servicios de emergencia y está demostrado que les salva la vida. Es algo que debe estar al alcance de todos aquellos que conocen a una persona en riesgo. Finalmente, quiero elogiar la labor del equipo de epidemiología y estadísticas RODA dedicado a recopilar cifras e información sobre el fentanilo en nuestro condado, así como el equipo del Departamento de Salud Mental por proveer varios programas como el de prevención y tratamiento de abuso de sustancias, a cual educa a la comunidad para evitar que las drogas caigan en las manos de nuestros menores. Hay que recordar que el abuso de sustancias es un desorden complejo que requiere intervención, por lo que el Departamento de Salud Mental ha establecido 13 clínicas por todo el condado para combatir el abuso de sustancias, 6 programas para tratar el uso de opioides y el nuevo Centro de Rehabilitación y Sobriedad, Arlington, para ayudar a aquellos bajo la influencia de drogas a transformar sus vidas de una manera segura. Gracias de nuevo. Es importante seguir a hablar de este problema y con esto podemos salvar más vidas. Gracias.
Good morning. Thank you all for coming out this morning. The Riverside County Sheriff's Office is committed to the collaborative effort of making the public aware of the dangers of illicit fentanyl. In Riverside County so far this year, there have been 338 deaths confirmed as a result of fentanyl, and we know that that number will significantly increase as toxicology results continue to come in. We will far exceed last year's fentanyl death total of 407 people. This is an epidemic that demands our attention. In an attempt to combat this problem, our office staffs an entire unit dedicated to fentanyl and the deaths occurring as a result of fentanyl poisonings. Our agency alone has submitted 19 cases of fentanyl-related homicide to the Riverside County District Attorney's Office and 4 cases to the Assistant U.S. Attorney's Office. I just need to add one more to that because we arrested another person for homicide this morning. Our agency alone has also seized 3,771,963 fentanyl pills and 398 pounds of fentanyl powder just since January 1st of this year. If you don't already know, let me tell you, that amount of fentanyl is enough to kill nearly 94 million people, or to put it into a better perspective, enough to kill the entire population of California twice. We are passionate about our efforts with our county partners in alerting our community members about fentanyl, enforcing laws related to fentanyl, lobbying for legislation to assist in the efforts to save the lives of those people who have been poisoned, and to continue to prevent fentanyl from entering our jails. Please don't be naive to the fact that fentanyl lives in almost every drug out there, and its powerful effects do not discriminate. We are proud to be part of this campaign and will continue our efforts to educate the public on the faces of fentanyl. Thank you for coming.
Good morning. My name is Mike Hestron. I'm the District Attorney for Riverside County. Fentanyl is becoming rampant in our communities. It's now found in all drugs: methamphetamine, cocaine, pills, and in some cases even marijuana. Often the user does not know that they're consuming fentanyl. We have taken a hard line at the Riverside DA's office and in the county, and dealers, despite that, dealers continue to peddle this poison into our community. However, the good news, word is getting out in Riverside County that we will not tolerate it. Fentanyl dealers now know we're going to hold them accountable for every life that they take. Our office is dedicated to this tough stance and prosecuting fentanyl dealers. We filed our first fentanyl murder case more than a year and a half ago in February of 2021. Since then, our office has filed on 22 defendants for fentanyl-related deaths. We must continue to prosecute these cases. It just might save someone's life. And of course, we need to focus on bringing justice to the family who has seen a family member lose their life. The fentanyl crisis in our community cannot be addressed by one department alone. It is a complex problem that needs to be tackled in many ways. This campaign is unique in the fact that it has brought together all department heads across Riverside County to work together to combat fentanyl in our community. We are a united front, making sure that people are aware just how deadly fentanyl truly is. I encourage you to share the PSA video and social media posts with everyone you know. Educating others about the dangers of fentanyl can and will save lives. Ahora en español. El fentanilo se está convirtiendo en algo desenfrenado en nuestra comunidad y se encuentra mezclado en todo tipo de drogas, metanfetamina, cocaína, pastillas y a veces hasta la marihuana. A menudo los usuarios no saben que el fentanilo está en la droga que están consumiendo. Los traficantes continúan difundiendo este veneno en la comunidad. Sin embargo, ya corre la voz que en el condado de Riverside no lo vamos a tolerar. Los traficantes de fentanilo ya saben que serán juzgados por cada vida perdida. Nuestra oficina está dedicada a tomar una postura dura y a la hora de enjuiciar a los traficantes. Nuestro primer caso de asesinato por fentanilo fue procesado hace más de año y medio, en febrero de 2021. Desde entonces, nuestra oficina ha juzgado a 22 acusados por muertes relacionadas al fentanilo. Debemos de procesar estos casos porque puede que salve una vida y lograr justicia para las familias que han perdido un ser querido. La crisis de fentanilo en nuestra comunidad no puede ser abordada por un solo departamento o agencia. Es un problema complejo que necesita ser atacado de varias formas. Esta campaña es única y que varios departamentos del condado de Riverside han colaborado para combatir el fentanilo en nuestra comunidad. Estamos unidos para concientizar a la gente de que tan mortal es el fentanilo. Los insisto que comparten este video y mensajes en las redes sociales con todas las personas que conocen. Educar a los demás sobre los peligros del fentanilo puede salvar vidas. Gracias.
Thank you for having me. My name is Christina Rodriguez, and I lost my firstborn son, Ernie Gutierrez, to fentanyl poisoning on August 24th, 2021. I feel that every parent who loses a child loses part of their soul forever. While living with someone with a dual diagnosis of mental illness, it can be a long emotional roller coaster. But you do all that you can because they're your life. They have a disease, and all you want to do is get them help for their disease. Ernie was just starting in his recovery, but fentanyl took him from me. We all have a story to tell. This is my story. Growing up, Ernie loved sports and played different musical instruments throughout his school years. He attended North Terrace Elementary School in Oceanside, Bella Vista Middle, and graduated from Temecula Valley High School in 2012. He couldn't wait to join the Marine Corps to continue his family tradition of serving his country. Ernie had the biggest heart and sense of humor, and unfortunately in 2016 we saw the onset of his mental illness and depression. With the help from the VA, Ernie was medicated and went through programs they offered. He often complained about the side effects of some of his meds. The treatment and meds didn't last long enough to stabilize him. It was around this time he started to self-medicate with illicit drugs. In the years to come, he would encounter many 5150, 5250 holds. When you have a son or daughter with mental illness, you never lose hope that one day they will get the right medication and help that every human being deserves. Thankfully, Deputy Lesso and his CBAT team at Riverside County Sheriff's Department saw the need for my son to get that extra help we so desperately needed. They put us in contact with Riverside Behavioral Health. This is when Ernie and I met with family advocate Alicia Hermosillo and clinical therapist Aurelio Sanchez. Aurelio was a veteran, and Ernie had an instant bond with him because of this. They took the time to get to know my son and did everything they could to guide him through therapy and acceptance of his treatment. They not only helped him, they helped me understand what's going on in the brain of someone with mental illness, that their reality is so very different from ours. Although a lot of us may not understand why some people resort to drugs to deal with their mental illness, their stress, or their anxiety, they were most likely seeking relief from how they felt, not death. So whether you are knowingly hooked on fentanyl for the different kind of high, or unknowingly take a pill from someone other than a pharmacist, doctor, you may die. Fentanyl is murdering our kids at record high. In 2021, nearly 108 deaths were caused by the ever-worsening fentanyl crisis we are in today. Fentanyl has no boundaries. It's everywhere. It's on our baseball fields, it's on social media, it's in the hands of our college students, it's in our jails, it's on the streets, in the hands of our mentally ill. Fentanyl is smuggled into our country and finding its way into all illicit drugs. It's impossible to avoid fentanyl. We need to talk to our kids of all ages about the dangers and lethalness it is causing. The discussion should be happening in our schools with our kids. Ernie did not get to finish the program he started with Riverside Mental Health because fentanyl killed him. We are in a crisis situation. We all as a community need to be part of the solution. One more thing I'd like to mention. The day I found Ernie, the same deputy who came to my house to help us with Ernie when we had episodes showed up for my 911 call on August 24th. Deputy Almada shared with me some of his encounters he had with Ernie outside of our home. That Ernie always waved and smiled and talked to them. He never ran away. They knew he was a good person and just needed help. So thank you, Deputy Almada, Deputy Stewart, for treating and respecting my son as a human being. Thank you. Thank you so much.
Good morning. I'm Chuck Washington. I'm the Riverside County 3rd District Supervisor. I can't think of anything more heartbreaking than the loss of a child. As Mrs. Rodriguez has bravely shared her heartbreaking story with us, I'm left with 2 points from a system and response perspective that I want to touch upon. First is that her son, Ernie, died many years before he should have or would have otherwise because of this deadly and extremely potent drug that is taking the lives of so many. Fentanyl is on the streets, getting into the hands of our loved ones, and it's taking their lives like no other drug before. The second point is that Mrs. Rodriguez shared with us a unique perspective. Thank you, Brooke. Mrs. Rodriguez shared with us a unique perspective in how our county has been able to put into action critical programs that join law enforcement and behavioral health. Ernie was able to meet with behavioral health therapists right in his home, following a referral from a sheriff's deputy who recognized that Ernie needed treatment for his mental health struggles. The deputy saw that Ernie needed more help, and he was able to make that connection based on his great relationship between all of the departments here. Pairing skilled behavioral health therapists with law enforcement is a crucial part of our field response. Oftentimes, deputies and police officers are the first to encounter someone who is in a mental health emergency or who is overdosing. Having a behavioral health therapist with law enforcement on site provides immediate therapeutic care to many people on some of the worst days of their lives. This service helps people get into treatment. That day, Ernie got help and may have even had hope for finding recovery and finding balance. As his mother shared with us, he had even started that recovery journey. Sadly, his opportunity for recovery and treatment was stopped before it really began. It was cut short from fentanyl. Fentanyl is having a devastating impact on our communities, and every department here today sees it up close. You can see from our county leaders who spoke here today and the department heads standing with us, the County of Riverside has diligently worked with intention to create a response to the unfolding crisis of fentanyl in our communities. I want to thank those department heads for the work of their teams in creating these compelling videos to reach our residents. I especially want to thank our departments for their tireless work in responding to this crisis and for finding ways to collaborate. I'd also like to thank the media representatives for being here today to cover this important topic. While much work has been done, there's still much more to do as lives continue to be cut short by this deadly and potent drug. As shared earlier by Supervisor Spiegel, we've created a campaign to help prevent poisonings and death from fentanyl. I will end on sharing two more short 15-second videos from that campaign, one in English and then one in Spanish. All of our materials are in both English and Spanish, and you can find them at our campaign website, facesoffentanyl.net. Thank you for being here today.
Something is poisoning thousands in our community. It's called fentanyl. The tiniest amount of it will kill you, and it can be found in pretty much every type of drug out there. You may think it won't happen to you, but you are not the exception. Don't be another face of fentanyl.
Hay algo que está envenenando a miles en la comunidad. Se llama fentanilo. Hasta la cantidad más pequeña puede matarte y se encuentra en todo tipo de drogas. Quizás creas que nada te va a pasar, pero no eres la excepción. No seas otra víctima del fentanilo.
For questions, I'd like to mention that in addition to our speakers here today, we also have several other county department heads. We have Director of Behavioral Health, Dr. Matthew Chang, Director of Public Health, Kim Sarawatari, Director of Emergency Management, Bruce Barton, Director of Riverside University Health System Medical Center, Jen Cruikshank, Director of the Department of Public Social Services, Sayori Baldwin, Director of Probation, Ron Miller. Now, in addition to the county employees, we also have specific employees from our Sheriff's Department and our Behavioral Health Department who, as Ms. Rodriguez shared with us, helped her son Ernie Gutierrez. We also have several other families here today with us who have tragically lost a family member, a child, a brother or a sister, or a parent to fentanyl. Again, as mentioned earlier, due to time for some of our speakers and also for many of our media partners who are working on turning their stories, we're going to focus our questions today on fentanyl or the media awareness campaign regarding fentanyl. If you have questions outside of that for any of our speakers, please find us after the news conference. Questions? Go ahead, Rob.
Just in case
So Narcan is the brand name of naloxone, and we years ago, 2 years ago, we had to make sure that every one of our deputies had Narcan on their person, and that we're probably over 10,000 lives that we have saved just because of that. There are other law enforcement officers in the state that have gone to that. I can't tell you that all of them have, but I will say that the majority know the importance and understand the importance of what this is, and the powerful antidote, if you will, for fentanyl. And I'll let the doctor answer those specific questions, but this was something that it was a no-brainer that we had to have, and it would be a disaster in Riverside County if our deputies did not have that on them all the time.
Yeah, we're very grateful for our deputies that have been carrying Narcan. The question of whether parents or families should be proactively, obtaining Narcan, in the event of an issue is obviously a personal decision. But for any family who feels that they may have a child or a family member who's at risk, we definitely would encourage you to have a conversation with their healthcare provider or mental health expert, because Narcan can be life-saving. It is one of the only things that you can use after an overdose to save a life. And so we do know that, many places that traditionally do not think of themselves as healthcare providers, whether they're schools or places where many people go to visit, many places are looking into making sure that they have Narcan on site and available just in that type of event. So thank you. Great question.
Great. Where will we see it? Exactly. So this campaign, important to note that all